Okay, so we are discussing today a patient, a 67-year-old patient, and that was a new diagnosis of adenocarcinoma of the lung. This patient presented with a mass, a 2.7 centimeter mass in the right lung, and this was discovered by a chest X-ray, but this was corroborated later by a CT scan. And a CT needle guide biopsy proved that this is an adenocarcinoma. Nowadays, as we know, in all lung cancer patients, it's necessary to do a genomic profiling of all of these patients, either in tissue or in blood. In this case, the genomic profiling of this patient that was done in tissue showed that he does not carry the most common mutations like EGFR, ALK, ROS1, BRAF. However, it was very interesting to find that this patient carries NTRK, fusion, or translocation. Also, as part of the workup, the patient had an MRI of the brain that shows that he already has a single metastatic small lesion less than 1 centimeter. And with all of this picture, a metastatic adenocarcinoma of the lung patient with an NTRK fusion protein, it was decided to treat him with larotrectinib. Larotrectinib is a new tyrosine kinase inhibitor, as we know, that we're going to review now, for this type of genetic aberrations. It was very interesting also to take the decision to not give a stereotactic brain radiation therapy to the single metastatic lesion that has been our standard of care for many years, because now we have an agent that can penetrate the central nervous system, and maybe these patients will not need any longer to be treated with stereotactic brain radiation, at least at the beginning. So this patient was treated successfully with larotrectinib, standard doses, 100 milligrams twice a day, and he responded for several months, and he stayed in remission for a long time. That's why we found that this case is very interesting, as is worth to review. When we talk about incidence of NTRK fusions in non-small cell lung cancer, it's a very interesting topic, because years ago when we started, I remember I had the honor to present in the World Lung 3 years ago in Denver, and at that time, the few data that was available showed that maybe up to 5% of the lung cancers have these genetic aberrations, because each of them have like a 1.5%, and when you add the 3 genes, we have close to 5%. However, as happens in most of the this type of science, as more testing we do, we found that the incidence is very low. In general, for example, in the paper that we had published with the first 55 patients in the New England Journal of Medicine, we found that the incidence was around 1% for all solid tumors. However, nowadays in lung cancer, that we have now hundreds of thousands of patients tested, we know that it's around 0.3%. Of the patients with lung cancer. In my own experience in my institution, the first time that we tested around 400 lung cancer patients, we found 3 only among 400. So that's why the incidence is very low. However, it's very meaningful, because lung cancer patients are 225,000 per year in America. So even if you say 0.3%, that's a large number of patients, even more common than some other rare cancers. That's why I think it's very worth it to test everybody, because we need to identify these thousands of patients that are going to benefit for this type of genetic aberration.